Healthcare workers are nearing their breaking point. That's what some working directly with COVID patients are saying during this recent increase. Hospitals in southern and central Illinois have felt the latest surge most acutely. And medical professionals across the state are preparing for what the fall and winter months could bring. Joining us to discuss what the latest surge looks like in hospitals across the state are Ashley Lakowicz, a respiratory therapist at Rush University Medical Center, Dr. J.C. Michael, Director of Critical Care at St. Francis Medical Center in Peoria and an intensive care doctor, Lupe Perez, a community nurse in Chicago and a member of Illinois' chapter of National Association of Hispanic Nurses, and Asi Klo, an ICU nurse at HSHS St. John's Hospital in Springfield. Thanks to all four of you for taking the time to join us. We appreciate it. Dr. Michael, let's start with you, please. So central and southern Illinois, as we said, are especially feeling this latest COVID surge. What are you seeing at St. John's Hospital there in Springfield?
At St. Francis in Peoria, we're seeing an eerily similar surge. It's no problem. Thanks, Brandis. A very similar surge to the previous surges we've seen. We were kind of naively hoping that we were past all this during the summer. We had no COVID cases in our hospital. And then about a month ago, we started to see a trickle. And now the slope upwards of COVID cases looks exactly like our previous surges. And we don't know when it's going to peak.
Asi Klo, how does this latest surge compare to those that you've seen in the past? Does this one hit closer to home for you?
Yeah, we're seeing a lot more younger patients. We did get quite, some the first surge, but they usually had comorbidities. But now these are people that are 20s, 30s, 40s, no medical history or anything like that, getting hit very, very hard and having to be put on the ventilator for an extended amount of time, and sometimes going to the drastic causes of ECMO and being so young.
Lupe Perez, earlier on in the pandemic, of course, we're hearing from many healthcare workers like yourselves who are afraid of going to work, contracting COVID-19, and then taking it home to their families. Is that a fear that you still carry?
Yes, I'm taking care of my mother who has lung issues herself. So every time I go into work, I'm always, making sure that I wear my PPE correctly, like I always have. But now it just seems like I'm extra, taking extra precautions, and I'm more stressed, right? I'm overwhelmed. I'm like, what if I do bring home something to my mother, and that will be the end of it? So I am really, it's just, I'm really concerned, and it's just more overwhelming now than any other issue that we had before. So COVID has been really tough for all of us in that regard.
So you'd say this is the worst it's been for you professionally?
Yes.
Ashley Lakowicz, over to you. Do you feel burnt out?
Burnout is definitely a thing. It is present. I think we're all feeling all of those feelings. This pandemic has not only been physically challenging, but also mentally and emotionally challenging. And my first career was actually in mental health. So that is something that's near and dear to my heart, to make sure that we take care of ourselves as well, because we can't take care of patients if we can't take care of ourselves.
Ashley, what are some of the mental and emotional challenges you refer to?
In a 12-hour shift, you might go through more than 10 different emotions. You have grief, you have fear, you have concern, you have anger, you have frustration, you have sadness, you have numbness. So by dealing with all of those different emotions, it is exhausting.
Asi Klo, how does being an ICU nurse during COVID compare to, before the pandemic? Obviously, based on what we hear from Ashley just now, obviously a lot more trauma and death, it sounds like.
Yeah, we, as ICU, we're not really, strangers to death. However, now it's become a norm for us. And as Ashley had mentioned earlier about the numbness, we do feel that as well, but there's the acuity level of our patient loads is increased drastically from what it was previously before the pandemic. We're having a hard time trying to keep up with our patients, as well as putting them on what we say comfort measures and trying to be with them when their loved ones can't. It's brought a tremendous amount of stress and just the abilities feeling like we're not doing enough, and a lot of frustration with that.
And Dr. Michael, would you say that, healthcare workers, the ones that you know and see and work with, are you all reaching sort of a breaking point?
I think if we're not breaking, I think we can see a point in the future where we might. This surge feels a little different. We're 18 months into this, and I don't know what human can continue to slog through something like this for a year and a half. It also feels a little bit different in that it feels a little unnecessary. It's like 90+% of the people in my ICU are unvaccinated. And you just can't help but wonder if we had more vaccinated people, if we wouldn't have had to have this. And so there's some layer of frustration of the unnecessariness of it. We didn't have to have this. And so that makes it even more prone, I think, to have us reach our breaking point.
We spoke with another respiratory therapist from Rush, Brady Scott. He talked about how the public can help medical professionals. Here's what he said.
As much as we appreciate, people giving us credit for being on the front lines, I don't know that we are on the front lines. When you come to the ICU, that's the end of the lines. You're on the front line, the public, you're on the front line of the pandemic. You help us keep the hospitals not so full.
And Ashley, Brady Scott is a colleague of yours at Rush, but what do you say to people, to viewers, as they also continue to weather this pandemic?
I think there is a tremendous amount of misinformation out there, and COVID is real. It's present, and it's not just affecting the patients, it's affecting families and friends and the public in general. And I understand the concerns about vaccination. I myself am a severe asthmatic, and I'm allergic to a wide variety of things. So I talked to my physicians, I read the research, and I asked questions before I made that decision to get vaccinated in December of 2020. And I highly encourage everybody to do the same.
Lupe, we've talked a lot tonight about, of course, the trauma that you all experience as healthcare professionals. How do you manage your own stress and emotions when dealing with all of this?
So recently, what I've been doing is just reaching out to my colleagues. So I am part of a nursing organization, so where we can get together and talk to each other about our stresses and what's currently affecting our personal lives, right? So a lot of outreach between all of us with our colleagues. So that's one of the things that I've been doing, which helps, right? And then also continuing to at least, advocate for vaccines and for masks, and in a way that when we volunteer, it's also a way that can help us, feel that we've done something for us, for our community, for ourselves. So that's a stress relief, and that is what we do too, to get through this.
And Dr. Michael, before we let you all go, what are your concerns as we head into the fall and the winter months?
My concern is that if we don't follow CDC guidelines and mask and get vaccine like Ashley and Lupe talked about, then we may never see the end of this. This may become endemic, and we may have 10 to 15 to 20 COVID patients in our ICUs forever. And that's just something that's going to keep us from getting back to normalcy. And I really hope it doesn't happen.
And I lied. I've got time for one more question, actually. Thank you, Dr. Michael. Ashley, before the pandemic, there was a bit of a shortage of respiratory therapists. How has this respiratory pandemic affected that?
Yeah, absolutely. We've always had a shortage since I've been a therapist for about 5 years. Being a respiratory pandemic, it has brought respiratory therapy in kind of the spotlight, whereas people didn't know what respiratory therapy was or what we do. And so now they're aware of who we are and what we can do. And based on that, our education applications are actually up. So hopefully we have more coming.
Okay. Thanks to all of you for the work that you do. Best of luck and stay safe. To Dr. J.C. Michael, Ashley Lakowicz, Ossie Klo, and Lupe Perez.
Thank you.
Thank you.
Thanks, Brandis.